The doctor found a growth on my tongue, sent me to an oral surgeon to obtain a biopsy. A few days later, we learned that the biopsy was cancerous. Hi, I'm Tom, and I've been coming to Affinity Smiles for about 10 years now. I had tongue cancer, essentially. Very quickly then, I was referred to and scheduled me for surgery just within a couple of weeks. It all happened very quickly, which I appreciated, of course. After the surgery, the surgeon said, oh, everything went well, that was good. The surgery itself was not as painful as I thought it would be in the days following it. There was a lot of inflammation, and they managed that with steroids, and I never even really needed opioids, so I felt good about that. And fortunately, those were negative for me, which meant I didn't have to receive any follow-up chemotherapy or radiation or anything like that. So I was really grateful for that. And after that, it was just 6-month follow-up visits for 5 years. And in October, I had my 5-year visit, and it's been cancer-free since then. With every visit, the doctor comes by and really does the visual inspection of my mouth and my tongue for any new growths or anything like that. Asks me if I'm feeling any pain or unusual sensations. I did feel a little bit of pain at the time, but I kind of dismissed it at first because I thought, oh, well, sometimes things happen. You bite your tongue or whatever. That is really important because it's one of the fairly common cancers and is also very survivable if you find it early. But of course, your tongue and your mouth, these are important organs for speaking and eating and other activities. So it's really good to follow up on that. And yes, the palpitations of lymph nodes and everything, both my dentist and my head and neck surgeon, who I follow up with, do that because of a lot of times it might be where you see the first sign of a growth is in a lymph node or somewhere else in your neck. Don't be afraid of it. Be vigilant and make sure that when you see your dentist that they are looking for any signs of it, and be aware of any sort of pain or strange feelings you're having, and inspect your tongue if you see something is there. And it's not that bad. So I lost, I guess, like 15 to 20% of my tongue, but for example, you probably can't tell from hearing me speak.